So the second cause of a back problem is something called the sacroiliac joint dysfunction or sacroiliac dysfunction. The sacroiliac joint is the junction between your pelvis here and your tailbone. So the sacroiliac joint is this junction right in here where those two bones come together. Now typically what you want to see is that when you bend and when you move, the spine is what's doing the movement. So you would bend over and this curve in your back would reverse and your pelvis wouldn't have to move a whole lot. But what's happening in an SI dysfunction is that for some reason, whether it be because the curve in your spine isn't the way that it should be, or the alignment of your spine isn't the way that it should be, or the muscles in your spine are irritated, what starts to happen is when you bend over, your spine can't move, and so now your pelvis has to start to move. And so your pelvis starts to move and it creates this friction between those two bones. And that's really what starts to cause that pain and that discomfort. It'll present itself as a little bit more of a sharper pain. It's generally localized right in your tailbone. A lot of times people will describe pain that's in their groin or in the front of the pelvis as well, because as that is moving, as that pelvis is moving, it's creating pressure in along your groin and the front side of your pelvis as well. But that comes from the fact that your spine isn't in the alignment that it should be and it's not being able to move the way that it should be. So something else has to start moving more to make up for it. The number one way to handle back problems is through physical therapy. So here at Loudoun Sports Therapy Center, our expert physical therapists are all expertly trained in handling low back problems. Really, the way that starts is with a full assessment. Somebody's got to take a look at what your problem is and how you move and what's causing the symptoms. Because just like that check engine light, there could be 1,000 reasons for what's going on. It could have originally started out as a muscle problem, but now it's beginning to exhibit some disc symptoms. And each of those things need to be addressed through some treatment. So basically, through a full comprehensive evaluation, we can figure out what are all of the things that are causing that back problem. Get you started on a regimen of things that's going to address them so that number one, you start feeling better right away, but more importantly, number two, we address this problem before it has a chance to progress into something else. Obviously, the easiest way to do that is when it's a muscular problem. A lot of times people don't handle that problem right up front. They'll wait until it starts to cause some symptoms down the leg. Now that check engine light's been on and it's stayed on for a couple of years or a couple of months at that point. But regardless, we can still handle all of those issues manually through some mobilization and manipulation techniques and hands-on techniques. Get the alignment of the spine back to where it needs to be. Get the control and the support of the spine such that the curves are where they need to be. Get the muscles to be longer and looser. So yes, that's some exercise, but it's also some manual techniques and some other techniques that go into that as well, to getting those muscles to relieve the pressure on the spine, open up the spaces, get the pressure off of the nerve. Yes, get you feeling better, but by getting those curves back to where they need to be, the alignment back to where it needs to be, now it makes sure that this problem is not something that's more likely to occur in the future or that's going to come back and cause you much greater problems in the future.